So today, I will talk about advocacy strategies. I am an internist and primary care physician in Houston, and I'm a DFA member. Um, the involvement of physicians, medical students, and healthcare professionals in advocacy is truly vital to impact the issues that we care about. Uh, so I don't want anyone to feel powerless and helpless. It's certainly a very difficult landscape to negotiate, but we do have the experience and we do have a certain power in our hands. First, I like to start with the definition of advocacy. Advocacy is an action that speaks in favor of, recommends, argues for a cause, supports or defends, or pleads on behalf of others. And as you can see here, a lot of that is about education, educating the legislatures on issues of interest, but also educating the public and the community on those same issues, educating the public about the legislative process, providing a nonpartisan voter education and nonpartisan voter mobilization, organizing training sessions like this one today, and participating in educational conferences. So learn as much as we can, network, share information, and plan for the future. Research and data collection are part of advocacy as well, because we need to be able to produce relevant resources that reflect the story of and the needs of our community. Publishing articles, op-eds, essays, so putting the word out there, again, in an effort to educate. And lobbying, of course, which is advocating for or against a specific legislation. But as you can see, lobbying is only one aspect of advocacy. Let me proceed. So how can we be an effective advocate? We need to have professional and lived experience, which we obviously do as healthcare professionals, a steadfast commitment to the cause. And commitment really becomes very important because, as you can see, this is a very daunting task. Medicaid expansion in this particular case, but a lot of healthcare related issues require a long-term commitment. Nothing changes easily and within a short period of time. Also, we need a little bit of political know-how, but the first steps in advocacy are concisely organize our thoughts. So we need to know what we want to advocate for, and we need to have clear thoughts about that. We can write down relevant anecdotes, practice presenting them, and collect data whenever possible. Collaborate, work with coalitions and groups whose philosophy and goals resonate with ours, and join professional organizations like Doctors for America, American College of Physicians, American Academy of Family Practitioners, and so forth. Now, why is it important to collaborate and to be part of an organization? It is important because this is something that we cannot do as single individuals. And medical organizations already have strong advocacy programs. Therefore, we can work within that advocacy framework. And not only medical organizations are important, but here in Texas, we do have a number of them, like Cover Texas Now, Sick of It Texas, Every Texan. All these organizations are consumer organizations who are advocating for expanded healthcare coverage and access in Texas. So we are all physicians here, but these are good organizations also to belong to. And for people who are not healthcare professionals, these are definitely organizations that they can join. So I want to share with you the results of a survey which was conducted among congressional staff in Washington, D.C., including chiefs of staff, communications directors, legislative directors, and legislative assistants. In this survey, now this was done in Washington, but of course the data are absolutely applicable to Texas and to any other state in the country. So the first question was, if your member, senator, has not already arrived at a firm decision on an issue, how much influence might the following advocacy strategies have on his or her decisions? So here in dark blue, we have a lot of positive influence, and in light blue, some positive influence. And from top to bottom, we can see that the one strategy that is considered the most effective is in-person visits from the constituents, or contact from constituents representatives, personal email messages, and personal postal letters. And if we go down here, even letters to the editors are considered valuable. Phone calls, pre-formatted letters or email messages, those don't seem to be very valuable. And the second question was, in thinking about constituents and the groups that represent them, what should they do more or less of to build better relationships with your office and your member, your senator? And right here on top, framed in red, you can see that the single most important initiative is to provide materials, educational materials, such as maps, charts, and infographics that visually show the impact on the district or state of a certain issue or bill. So this is very important to keep in mind. And then again, meet or get to know the legislative assistant. And they even say provide materials ahead of time. I usually don't do that because I'm always afraid that the material will end up under a big pile of papers and be forgotten. So by bringing with us educational material is at the very top in terms of advocacy strategy. So let's talk about the in-person visits. Again, the in-person visit is the single most effective advocacy technique. Keep in mind that you won't always be able to speak directly to the legislator, and often staff members will meet with the constituents. Usually 15-20 minutes is the most you can have in one of these meetings. Use group presentations with careful planning. So one person must be in charge, plan who is going to say what, have a presentation outline, and leave time for questions. Don't overwhelm the legislator or the staff members with details. Don't have a confusing scene at the office. Don't get into discussions with one another, which, believe me, can happen. And very importantly, don't give inaccurate information. When we don't know the answer to a question, then we just have to say that we'll get back to them at a later time. Now, here in this picture, you see a pretty large office, okay? But usually these offices at the Texas Capitol are very small, so groups larger than 3-4 people are a little too much. So just keep that in mind. let's proceed with some grassroots advocacy tips. Now, you need to know your audience, right? Who is your elected official? Is your representative a Republican, a Democrat? Is he or she liberal, moderate, conservative? What issues are most important to them? And do they serve on a key committee? What bills are they supporting or opposing? So, in one word, we need to be prepared. We have to use the personal anecdotes as well. We have to tell our legislatures how the issue affects our colleagues, all of us, and our patients. And we have to position the message from the perspective of my patient, my practice, and patient access to care. And again, know your issue and bring those effective handouts, okay? Those are very important. So present your opinion and back them up with facts, uh, data, statistics, studies to support your point of view. If there is a specific bill, you have to include the bill number and research where the bill is in the legislative process. Know the opposing argument and the frequently asked questions. So before we go ahead to more grassroots advocacy tips, I want to focus a little bit on the importance of handouts. Um, Many of you may be familiar with the TMA, the Texas Medical Association First Tuesday Advocacy event that are planned during the legislature. For example, last year we had First Tuesdays on February, March, April, and May. And what TMA does actually, they give us a big package, which I want to show you. And in this big package, that you have a lot of flyers with very detailed information about the issue at hand and the bills that they are opposing or supporting. And also they have a bunch of cards, little cards that we can leave behind at the office of our legislatures. So in the next slide, I'm going to show you a couple of these cards. The print is very small, of course, so you won't be able to read it, but look at the titles: Improve Health for Mothers and Babies. And here you can see a list of the bills that were supported. And this is I'm going to focus only on HB 916, which was about allowing women to obtain up to 12 months supply of contraception at once. And the next card, ensure the best possible healthcare for Texans. Here is where HB 12 was listed about extending Medicaid postpartum coverage to 12 months. These cards and these flyers are so important and valuable because not only will help your legislator and the staff members, but they're great help for us too. So keep in mind, go prepared, bring material. In the next slide, we're going to go through a few more grassroots advocacy tips. Now, be mindful of timing. So when I say timing here, I'm not referring to those 15, 20 minutes that we have available, but I'm referring to knowing if a certain bill has already passed out of a committee or chamber, or if the bill has been already killed or is moving forward. So we are not going to be very effective if we are asking a legislator to wait on an issue or a bill that has already been discussed and is already killed or passed. So be mindful of that. Building a trusting relationship, of course. Be in touch. Make sure that they get to know you. and be polite, persistent. Thank you notes are appreciated, and also act locally because every legislator has a district office and they do hold the local meetings. So you can call the office yourself or you can ask your county medical society executive for assistance in scheduling a meeting. Um, Getting close to wrapping this up, I like to remind all of us that the Texas legislature meets every other year, and this is when advocacy is most intense. However, state advocacy is ongoing between sessions, as stakeholder meetings, interim hearings, through rulemaking input. And so keep on pressing forward and learn as much as you can, know the data. And Mr. Janda today helped us a lot in really understanding the intricacy of the Medicaid landscape. So be prepared. Create your personal narratives. So anecdotes and patient stories are very important and they need to be balanced with data and statistics. And if you can publish, put the word out there, email or send letters, personal letters to your representatives. So continue pressing forward. And as I thank you for your time and attention, I also like to read a statement from James Baldwin. Not everything that is faced can be changed, but nothing can be changed until it is faced. And I really felt compelled to say that because, again, advocating for Medicaid is such a daunting task, but I don't think we really should give ourselves the option of giving up just because it's tough. So we need to continue pressing forward and eventually at some point in time, if politics will align with policies, we will see that happening.